Woombie Med Pods are the first and only 360-degree swaddle that work around medical devices and treatment needs for neonates and infants on the pediatric units. Let's talk about the features. Woombie Med Pods were designed with a patented peanut shape to allow for range of motion in the shoulders and the hips to prevent hip dysplasia. The slide stretch of the fabric assists with flexion, supporting muscle tone development as the infant wiggles and squirms within the pod, similar to the way they moved in the womb. The double zipper allows easy access to the infant feet for checking ID bands, pulse ox, heel sticks, IV, or blood draws. Plus, diaper changes are a breeze for caregivers who may be intimidated by the complexities of a traditional blanket swaddle around their sick baby. Each of the pods was designed to support specific patient populations that have historically been left unswaddled due to medical devices or treatment needs. The trach pod features a deep V-neck for babies with trach or post-operative cardiac babies whose dressings need to be visible, clean, and dry. The side slits can be used for Broviac lines for HEMOC infants to receive blood, iron, or chemo. The gastropod features a midsection flap that can be unsnapped for babies with colostomy bags, stoma, umbilical complications, post-operative gastroschisis, or servo babies. Even those with G buttons can receive feeds while staying swaddled. We anticipate the trach pod and the gastropods being sent home with patients for continuity of care and safe sleep, as many of these infants will be discharged for home health with their devices still intact. The Woombie Sleepy Pod is designed for mother-baby units to promote flexion, comfort, and safe sleep from birth for full-term, healthy newborns. When purchased in bulk, we can add hospital logo to the pod. We recommend every newborn receive a Woombie Sleepy Pod in their welcome basket from their birth hospital. The Woombie Med Pod is a slight variation from the Sleepy Pod, allowing lines, leads, tubes, and drains to be weaved through the slits cut here at the top and the sides of the swaddle. The Med Pod is our catch-all pod that can be used on almost any unit, including the ER, to comfort babies being admitted and triaged, or can be used for procedural support during EEG, circumcision, PICC line placement, or wound care. This is the pod I feel child life specialists will be the most supportive of, as it could be kept in treatment rooms to replace papoose boards.